recording this session. So we just started doing that now. So the video is recorded, and anything that you chat to everyone in the chat box will be recorded, but all private messages stay private. And so that you know you're in the right room, our presentations today are on transportation, specifically to cancer patients. So just our quick ground rules. I'll bring them up on the screen if you're in web view. As I mentioned before, always mute your microphone when you're not speaking. And remember to if you're on the phone, don't put us on hold because we'll be able to hear your music. We encourage everybody to use the video feature. If you have that capability, it just creates a better sense of community and knowing each other, to put faces to names. If you don't have a video, that's completely okay, we understand. But do remember, if you're using your video, we can see you. So just keep that in mind. As always, never disclose any protected health information that might be in violation of HIPAA. We really strive to keep everything confidential. If you'd like to speak, you can raise your hand, either physically, say, excuse me, I have a question, unmute yourself. Or as I mentioned before, you can always send a message in the chat box, and Caitlin will be monitoring those throughout the conversation today. So if we don't get to you right away, we'll get to you at the end. And if we aren't able to get the question at the end, we'll follow up with answers to all the questions afterwards. Simple reminder, speak loudly and clearly if you do have a question or if you are presenting. And as I mentioned, today's topic is on transportation. So please try to keep all questions and comments related to that topic for transportation and cancer patients. So in the spirit of building community, we'll go around and do introductions with everyone. And so that we can eliminate any talking over of people or everybody going at once. I will call out your name and have you introduce yourselves. And it can just be your name, where you work, a title if you want. And that would be great. So as I mentioned, I'm Heather, and I will let folks in our room at MCF introduce themselves to start.
Hi, everybody. I'm Caitlin Misha. I'm a program manager here at Maine Cancer Foundation, focused on our grant making.
Hi, and I'm Cheryl Tucker. I'm the executive director at the Maine Cancer Foundation.
And Lori Dyer, do you want to go first? And just remember to unmute yourselves when you chat. All right, we can't seem to hear you yet, Lori, so we'll circle back to you. Magda, do you want to go next?
Hi there, Magda Alden, American Cancer Society patient navigator at Maine Med Cancer Institute.
Thank you. And Michelle, would you like to take it over?
Michelle Hayes, Maine Health social worker in Midcoast Medical Groups, also Coastal Cancer Treatment Center in Bath and Miles Hospital.
Welcome. And Michael, would you like to go next?
Michael Reisman, Executive Director of the Beth Wright Cancer Resource Center in Ellsworth.
Thanks. And Tori, your group, do you want to go next?
Tori Lavoie, I'm the Financial Advocate Manager for New England Cancer Specialists.
Annabelle Harcourt, Financial Advocate in Scarborough.
We have Kim Shaw in here too. She just stepped out for a quick second, and she's a financial advocate here in Scarborough.
Great, thank you. Welcome to all of you. And Cersei, do you want to go next? Maybe she can't hear us. All right, how about Heather?
Sure, I'm Heather Ciccarelli. I'm from the American Cancer Society. I'm the Senior Manager of Patient Navigation.
Thank you. And Amber, does your group want to go next?
This is Amber O'Leary. I'm the Patient Navigator for the Head and Neck Cancer Department and Memorial Hospital in North Conway for Maine Health. And
this is Manny Ortega, Upper GI Navigator, Maine Health.
This is Leslie Foreman, Lower GI Navigator, Maine Med.
And Tracy Watts, Melanoma Navigator for Maine Health.
Welcome to your group. And Robin, do you want to go next?
Sure. Robin Latart, financial advocate at New England Cancer Specialists in Kennebunk.
Thank you. Welcome. And Mary, can you hear us? Maybe not.
I can hear you. Hi, I'm Mary White. I'm a patient advocate at Eastern Maine Medical Center, Cancer Care and Brewer. And our new name is Northern Light, Eastern Maine Medical Center, Cancer Care.
It's a mouthful. Thank you.
Yeah.
Devin, would you like to go next?
Can you hear me?
Yes.
Okay. Yeah, this is Devin Alexic. I'm right next door to Mary, and I'm over at Northern Light Cancer Care, patient advocate.
Welcome. Thank you. And is there anybody else that I missed?
Do you have us here at Mercy Fore River? Circe Damon, nurse practitioner from New England Cancer Specialists, and
Christine Brome, Northern Light Cancer Care, social worker and patient financial navigator.
Thank you. Welcome.
Kim is back. If she'll put her head in. Here's Kim.
Hi, I'm Kim. I'm a financial advocate at New England Cancer.
Well,
Could folks on Circe type in your names? I didn't catch the last one. I'm not sure.
It's Kim. And my last name
Christine.
And Sarah, would you like to go next? I think you might be the last one.
If I have it right, so my name is Vera Popov. I'm a financial advocate at Topsom, Maine, New England Cancer Specialist office.
Welcome. Thank you. And is there anybody else that didn't get a chance to introduce themselves or put their information into the chat box? Okay, great. So now we will move on. As with every ECHO session, we hear a didactic presentation from two experts on the session's topic. So today we'll be hearing from Magda Alden and Michael Reisman on the topic of transportation. And then they'll have about 20 minutes to present. We'll take a few minutes for any clarifying questions, and then we'll move on to our case study presentation, which will be given by Michelle Hayes today. So a big thank you to the three of you for putting together the presentations and pulling together the case studies. And once we're done hearing the case study, we'll have an opportunity to hear from Magda and Michael about their input and feedback regarding the case, but it's also an opportunity for everybody to chime in to give feedback and really have groupthink and learning so that we can all increase our skills around this topic. If anybody else has a particular case that they didn't submit ahead of time but would like to share with the group and get feedback, there's opportunity for that as well. And we'll wrap up right at 4. So I will kick it over to Magda and Michael. And whenever you guys are ready, go ahead.
So our learning objectives are participants. I need to move the faces. Okay, hold on, sorry. I can see now. Participants will understand the importance of cancer treatment scheduling and getting to that treatment. The navigator will learn that transportation and financial assistance options available to getting patients to treatment. The navigators will learn what patient factors are needed to take into account to arrange for successful access to treatment, and participants will learn what the barriers to getting the patients to treatment are. Next up, there we go. And this slide was taken actually from, what was it, blanking on what it was, the Transportation Summit that Maine Cancer Foundation hosted, just showing kind of the barriers that patients face with transportation issues. So I think they were like the popular words that came up during the assessment that was done. I just thought it was interesting. Obviously there's like distance, different transportation options, being rural, having access to a car, funding, the areas that the people are located in, which is kind of the rural aspect, the inability to transport themselves. So I just thought that was a good slide to show to overview some of the biggest barriers that patients tend to face. So next slide. So I figured I'd start with the main care transportation programs because there's a lot of detail that goes into that, and so I wanted to kind of try to break that down a little bit because it does get very confusing. The first thing that I tend to start with a patient if I find out that they have main care is finding out if they know they have a transportation benefit. I either hear no, they don't know, or yes, and they're not using Logistic Care. So those are kind of the two answers I get. But if you're looking at somebody's chart, I know that different systems do it differently, but in Epic, it's kind of coded so I can tell just by looking at it if they have a transportation benefit or not. The basic, if it says they have Quimby or Slimby, well, it won't say Slimby in the system anyway, but if they have Quimby alone, I know that they won't have a transportation benefit, but the other programs with main care, they do have a transportation benefit. If I ever question it, I can call any of the brokers and give their information, and they can run it through the system and let me know if there is a transportation or benefit or not. The next link is the different transportation brokers listed by county. I have this printed out and hung up next to my desk so that I have easy access to it. Most of them are county-based, but then there's random ones, counties that fall into different categories. So it's really important to just double check the list almost anytime that you're dealing with a patient so that they can know what those links, what those are. And it's hyperlinked there so you can get access to it. Heather's pretty good at emailing this out within a couple of days, so you should get access to that pretty quickly. Transportation does need to be booked at least 48 hours prior to an appointment. I'm pretty good at getting exceptions to be made for those cases, but Logistic Care especially can call the doctor's office and see if they'll reschedule the appointment. So it's good to know whether or not you're pulling strings for the right reason or not, or if somebody's going to answer the phone and say, oh, they don't need to be seen right now, and they can reschedule it. So for most things, though, related to cancer, they're pretty good at calling last minute and getting the patient in for the most part. Next slide, please. So in that regard, it's really important to designate that it is for cancer care. So if you're calling and scheduling a ride for a patient, marking down that it's radiation or a chemo appointment makes them prioritize. So if that is not noted in the system as that, their ride does not have to be fulfilled, especially, so weather-related cancellations are especially important for that. So if they put out a warning saying that rides might be canceled, they have to make every accommodation possible to get a patient to a radiation or a chemo appointment. You know, safety does play into account there, obviously, but they will cancel all rides except for radiation appointments sometimes. So it's really good to make sure that's documented. Also, if they live in areas where drivers are hard to locate, they do have to make it a priority to get those patients to their treatments. So again, it's just really important to stress that it's a radiation or chemo appointment for that reason. The biggest change with main care as of August 1st, they are no longer allowing companions to come with a patient to their treatments or to their appointments or anything unless it's medically necessary. So this was a huge change. We could have somebody, I think they would take the whole family if need be. Now you have to have a letter of medical necessity from a physician saying that this person needs somebody with them, why they need them with them, and it can take several days to get that approved. I spent a day a couple of weeks ago calling and making sure that we had the fax numbers to be able to send over the letters of medical necessity to all the different brokers so that if we get a call from anywhere that a patient that we have all of those and we don't have to go searching for them. And that is a little bit stressful because we don't, you know, patients don't know all the time that they're going to need somebody with them for certain appointments, or they don't know they're going to get an appointment until the last minute. So they might not be able to have somebody come with them. So it's a little bit of a challenge. I'm not sure how we're going to circumvent some of those issues. But I guess time will tell. And that goes across all brokers, Logisticare, Midcoast Connector, KB Cap, all of them require this now. And the other big issue that I find that people with Maine Care do not know about is that they can get mileage reimbursement for any medical appointment. I ask people that all the time, and they're not aware of that. So I'm constantly printing out their mileage reimbursement form, giving them the phone number to call, walking them through the steps about what they need to do to be able to get that mileage reimbursement. So they could either have somebody pick them up at home and drive them to their appointment, drive them back and get free transportation, or they could get mileage reimbursement. And it's really easy. They could call like a minute before their appointment with Logisticare and be able to get credit for that ride. So they can't call after it, but they can call leading up to their appointment and be able to claim mileage reimbursement for that. So it's really good to make sure that patients are aware of that benefit. And that's, I think, one of the biggest things that I wanted to stress during this was that that could be a huge benefit for people if they didn't know that. Next slide. So I end up booking a lot of rides for patients because I find that it becomes too overwhelming for them, that trying to navigate the system can be really stressful. So I was trying to think of ways that, I try to empower our patients to do that themselves. And I work with them, try to teach them how to do it, give them the skills to be able to do so. But ultimately, we know that some of our patients can't do it, and they need somebody to do that for them. So I just really wanted to emphasize that it's important to recognize what our patients' abilities, stressors, and limitations are, and how we can help them advocate within those, and how we can maybe give them some skills and all of that. And that's really understanding the system ourselves and understanding how we can best support them through that. And I think I just said all of that. So next slide, please. Okay. So this skips over to, I think we're done with Maine Care, I think. So different barriers to consider within transportation is if they haven't access to a vehicle, and if they do, can they drive themselves, or do they have somebody to drive them? The distance, a lot of patients travel a pretty great distance to come to appointments. We have patients traveling daily for radiation that are driving from North Conway, New Hampshire, and other ones that are driving from, to the Bath radiation site from a pretty big distance as well. And those just add up, time, financially, fatigue, it's exhausting. And so considering the amount of appointments patients have, that can just be a barrier in general. Thinking about the times of the appointments that patients have, if somebody, like they're saying, coming from the North Conway area in the summertime down 302, that is just going to be basically a whole day for them to be able to travel back and forth for their appointments. And so if they're looking at what they're, if they're looking at scheduling appointments, or we're looking at helping them schedule the appointment, what time of day is going to be best for them based on some of those issues, that would be important. Also, is there lodging locally? So if we know that we have somebody that's traveling from a great distance, and if they can get down the day before, maybe they could stay overnight to help alleviate some of those stressors, but then there could potentially be some barriers associated with that too. But I just listed some of the different programs that might be available if we took that into consideration. And then one of the biggest challenges that I see is if a patient's getting surgery or colonoscopy or anything with anesthesia, sometimes they're not allowed to be discharged to like just a taxi or a provider. Sometimes they need an escort, all of that. So it's important to kind of see what those barriers are going to be and sort those out, because I know we get a lot of requests for people after surgery, and it's just really, they can't always just thrown in a vehicle with somebody that doesn't know them. Some transportation providers can't take those patients. So knowing that, like, what can we do to help support the patient so that they can get the surgery they need and that that's not a barrier for them. Next slide, please. Obviously, financially, how that's just a huge barrier. Gas and car expenses, you know, looking into or just keeping a car running in general can be expensive. Making sure the car is registered can be a huge issue for patients. So seeing if there's any mileage reimbursement programs or using a volunteer program could potentially be something to consider. And then say they had a family member driving them every day, that family member could be working and there could be just a loss of income, and they're feeling the stress on that family member to take care of them as well. Mobility issues is a huge barrier. Patients getting in and out of a car, if they need assistance, they can't always use some of those programs to help them get in and out of a car, because volunteers have limitations within themselves to be able to get a patient. They can't pull a patient in and out of a car, so the patient would really need to be able to pull themselves to a stand and get out and all of that. They could potentially help with a walker or a cane or something like that, but it's just things that we have to ask about before we set a patient up with a transportation program. And then another one that's becoming more of an issue is some patients do have cell phones, but they might not receive text messages. I do have patients that don't have any cell phone, and some transportation providers do use Uber or Lyft as like a secondary option for transportation. Main Care does. So they send the patient a text message with confirmation, this is who's picking you up, and those patients don't get those text messages, so they don't know who their ride is going to be. So it's just really important to kind of find out when you're talking to a patient what those limitations could be. So do you have a cell phone? Do you receive text messages? Yes or no? And then we can kind of say they have Main Care, and when you're calling to schedule a ride through Main Care, you let them know that they're not able to receive text messages, and that's marked in their chart. And then they, I believe they wouldn't use Uber or Lyft unless we absolutely needed it to. And sometimes, like, I have a patient that doesn't have any of that, but we do get Lyft quite a bit for her. I call up at the exact time that she's supposed to be picked up and get the name of the car, and I'm able to communicate that to the patient. But that's a lot of coordination and can be stressful all around. Next slide, please. That is you, Michael.
Magda. Okay, so this is about what happens if people don't have Main Care. And I'm based in Ellsworth. Many of the people I work with live in Hancock and Washington County. They also travel hundreds of, well, as far as 200 miles round trip to get to the radiation treatment center in Brewer. And so we're also sort of like in this area, we have a fair, in our counties, having volunteer driving programs. There's Friends in Action and Island Connections that have a lot of volunteer drivers. That's something in your area. I don't know if there are volunteer driving programs, but they're certainly been very valuable in this area. And one thing I noticed that most of the people on this call are from Southern Maine. So if you, and I also know there are programs, there are certain types of cancer diagnoses that are only treated in the Portland area. Ovarian cancer is an example. So if any of you are looking to get somebody, have been tasked with getting somebody from Hancock County, Washington County, or Northern Maine, you might consider reaching out to either me or other, say me, maybe Friends in Action. I can give you some phone numbers, and they could assist you in using volunteer driving programs to get patients down there. We also work with Road to Recovery. that entails calling their 1-800 number to set up an appointment for the person needing the ride. It has to be done 5 days in advance. It's not really good at the short notice rides, which a lot of times come up. Now, one thing about Road to Recovery, though, there is Elisa Medor is the American Cancer Society program representative in Maine, and she is able sometimes to call the 800 number and intercede on occasion. I just talked to her before this meeting. I said I might tell people this. So there is some flexibility, although not great amounts of flexibility in the Road to Recovery system. But I would recommend this calling Elisa Medor, whose phone number is 462-6307, and if there's an issue, talking with her. One thing, veterans are a group that if you're looking for a ride assistance, there are a fair amount of programs for veterans. And I just spoke yesterday with a woman named Giselle White, who is a mobility manager for the Veterans Administration, who I'd heard about for many months from Joe Cooper at Friends in Action as somebody who, whenever she called her, had an answer. And so they do have a lot of funding. They have MOUs with a lot of CAP agencies, and so they can get reimbursement for transportation for people, for gas reimbursement, and they also have some volunteer drivers and some vans. They're not really able to take somebody 5 days a week to radiation treatment, but they might be able to help 1 day a week or so, and depending on the need of the patient, they can help. And what it sounds like to me is if you call her and this person's a veteran, she has a commitment. She makes a commitment that she's going to find some type of answer to help. So, it's, I was very impressed. Sounds like it's a very strong partner. And one of the things I would say in this whole transportation issue is trying to find the experts in certain areas and trying to find people who you can rely on. And in working on this PowerPoint with Magda, I've learned that she's a pretty much of an expert in the Portland area. And she's also telling me how she gets people from northern Maine down to Portland. So I now have her phone number, and I will not hesitate to call her to get help, brainstorm, and the like. So I think that's something that identifying who the expert is in your area and develop this relationship with them, because it definitely is who you know a lot of times as opposed to what you know. There's one of the things about qualifications for veterans. There are some qualifications, and probably calling Giselle would be clarifying these. But if somebody has received disability of 30% to 100% through combat, or if they receive a VA vet pension, or if they're a veteran that makes $13,000 or less in income a year, they should be eligible for these programs. And her phone number is 623-8411, and her extension is 5696. And again, she said that she urged people to call her. That's what she does. It's interesting, actually, many years ago, or about 10 years ago, we did a study, and actually we found that we surveyed 40 people from Washington County who were traveling to Brewer for treatment. And we found that basically only about 1 in 5 of those people really saw volunteer drivers as their first choice for getting to treatment. It's probably not the vast majority, almost 100% of people preferred either a reimbursement by check or a gas card. So a lot of times you might offer volunteer drivers to people, but they really want to go with family to get there. So the reimbursement programs are very important to people. The Maine Cancer Foundation, with their transportation assistance grants that they've given out to quite a few agencies, are not income related, and most of those CAP agencies that have gotten it are using them for people who are not on Maine Care. There's also some, if you have breast cancer, there's a Maine Breast Cancer Coalition who's able to reimburse people for a variety of issues related to their cancer treatment, but one of them is transportation, and they have the support service fund, so that's a great place to go. Leukemia, the Leukemia Lymphoma Society has a smaller benefit, $100 benefit for people that reimburse people with transportation. And, but that's something, an area to look into. Also up here in this area, Eastern Agency on Aging has a fund that will reimburse people for medical costs of travel. So that might be something to look into, hospitals and treatment centers. And actually the treatment center in Brewer, Devin and Mary White have access to funding for motel stays and gas reimbursements. And we coordinate that pretty well, how that is handled. But so that's something to consider when you're looking for funding. As far as then there's PALS and Angel Flight. That's for us. I mean, people again in this area traveling to Boston can be they're traveling 300 to 350 miles one way. PALS and Angel Flight, they have flights that are available at different airports that can handle small planes. They also are pretty good at getting people from where they're from the ground transportation, getting people from the airport to the treatment center. They also have received the grant from the Maine Cancer Foundation, each of those organizations, and why they got that grant, a lot of it was for outreach and so that they can increase their service to people living in Maine. So I, again, wouldn't hesitate to reach out to them, and they've made a commitment to help more with getting people to their treatments. And then public transportation. We do use cab companies, or a lot of times people are able to take a bus, and so we always keep that in mind. We have one local cab company who have a couple of drivers who are very caring. And actually, one of the thoughts, we've reached out to them and also about trying to get them, suggesting that they take a volunteer driver training so they would feel even more comfortable. And that could be done. There's one through the American Cancer Society's orientation is now online that you have to call the 800 number to sign up for. But also we have our two local volunteer driving programs who could also offer orientation to them. So public transportation is definitely something to think about. And the family does have to be a part of this equation when they're able to. So especially in radiation treatment, if you're traveling 5 days a week, that's a challenge. So I think families are willing, when they're able, to help out once or twice a week. It's just the idea of doing it 5 times a week that can be overwhelming. So I would say don't hesitate to involve the family in this process when it involves radiation. And one of the things, our overall goal in providing this transportation to treatment is to basically that we want to get the patient to treatment safely, on time, and with little stress as possible for the patient. We try and take on all the stress, and we don't want the patient to be stressed out. So so if somebody calls us the day before and it's a challenge to do it, we make a point to not berate the patient or even make them feel like we tell them that because it's short notice, it can be challenging and we can't be sure that we can get a ride, but we're going to do everything we can to get the ride. And in the future, if you give more notice, and there should be no problem. But in that regard, a lot of times things happen. Appointments are made at the last minute, and so we try to not get on the patient so much. Next slide.
Thanks, Michael. And just so you know, you have about 2 more minutes.
I'll do it. So basically, treatment in Boston, I think a lot of you probably are more knowledgeable about getting people to Boston than we are. But again, we use different programs. We take advantage of housing. Hospitality homes for us is a great option to offer people if they're staying in Boston for more than a few days because of the cost of housing. And there is a program in Boston that we found about called Friendship Works that will actually escort patients to appointments. So sometimes if you get a patient to Boston and even with a caregiver, they don't feel comfortable getting to the appointment and being there with the appointment, they have a program that will escort somebody to an appointment. And I can send a phone number for you about that. And that's basically covers what I would say.
Can I add just 2 clarifying things? One was ACS Road to Recovery is only 3 business days for requests. So just to clarify that. And then the other one that I forgot about was some insurances you offer transportation benefit beyond the main care. So I always encourage patients to just call and ask for an insurance case manager and see if they have an insurance benefit. One Medicare program that does offer transportation is Humana, which is a Medicare Advantage plan, I believe, and they have a benefit through Legit Care, whole different phone number way that it's structured, but it is another option. They just encourage patients to look into too in case they're running into some issues. That's it.
Thank you both very much for that presentation. We are running slightly behind schedule, so we're going to put questions on pause so that Michelle can present, and then we'll do all the questions about the presentation and the case study at the end. So Michelle, are you ready to present your case?
I am. I think my video is frozen, at least from my view, but the phone's still working.
Okay, good.
Okay, so I had chosen this case study to present I think 2 months back actually with regard to financial support, and Heather and I talked it over and decided it was really more of a transportation barrier, and so we saved this presentation for today. So this patient is a 60-year-old white married male. They have 1 son with autism who just graduated high school this June. The patient was diagnosed with prostate cancer. His treatment plan was for radiation, 44 treatments. They live in Hope and were traveling to Bath for those treatments. The patient and his wife are both disabled, as is their son, and so they're already on a very fixed and limited income. They do have a strong connection with their local church, which turned out to be very much a saving grace when it came to pinches in financial support, and they were needing to maybe cancel treatment some days, and instead were able to ask their church for help, and still needed to cancel sometimes, but their church was very connected with them and very helpful. As far as ethical issues, maybe not an ethical issue per se, but we did have one issue in the patient waiting room during these 44 cancer treatments. The patient's wife was very vocal about their financial challenges and would kind of talk to whoever was there, and was given money by another caregiver one day, which we found out about after the fact and knew we would nip that in the bud if it continued, and luckily it did not. But it was just sort of one more layer of a challenge, maybe not so much an ethical issue, but definitely a challenge. Next slide, please. So the challenge with this family was that they did have a van that I don't know if accessible is the right word, but it was somewhat modified to transport both of them. The patient's wife had been in a bike versus motor vehicle accident when she was younger and used a cane, and so being able to ride in their own van was important to them. The distance they were traveling was also a factor. If we were adding logistic care transportation or another provider onto that at both ends, it would have been almost all day that they would have been traveling to get to and from treatment. So they agreed that their own car was definitely the best option. So we did connect them with main care transportation reimbursement since they didn't want to sign up for rides. We did try and connect them with the Road to Recovery program, but there weren't any volunteer drivers in the Hope area at that time. And this goes back a few months. Michael did reach out to me yesterday, I think, and let me know that through contact with Alyssa Madore, that there are increased volunteers now in the Hope area, which is great to hear. But there weren't any this spring when we were looking for this transportation. We did help with gas cards from time to time, especially while we were waiting for the main care reimbursement to take place. As I mentioned, their church was very helpful in helping them at the last minute when they weren't sure they would be able to make it to treatment that day, or they'd be able to make it, but they wouldn't be able to make it home. Grocery cards from time to time were also helpful as they were spending a lot of money on gas to get to and from treatment. And then significant emotional support along the way as they were dealing with the stress of this new layer of difficulty in their lives. Next slide, please. So the biggest barrier with this family was definitely just lack of resources, their own finances, and not really having any disposable income to allocate to this new diagnosis. Geographical barriers in terms of the distance they were traveling to treatment and the limited number of resources, whether it be main care or Road to Recovery, that were available to help them with transportation. And then also just the multiple comorbidities and disabilities that the family was facing that made just going through treatment and traveling to and from an additional challenge for them. So that is my snapshot. The questions that I put together were knowing that this patient in this case study may be more unique than most of the patients we work with in the multiple barriers that were going on here. But we do often work with a lot of patients whose transportation options are slim at best. They don't have any extra income to apply to transportation costs. And when we're trying to connect them with care as close to home as possible and travel still remains just out of reach, what can we do? I was also questioning how we minimize or eliminate the gap that exists between patients wanting and needing cancer care and the variabilities that afford that care, or variabilities to afford that care. And again, just touching on transportation, financial funding, and trying to keep those patients as close to home for their cancer care as possible.
Thank you very much, Michelle, for that presentation. So what we typically do after the case study presentation is give a few minutes for our presenters, Magda and Michael, to respond to the questions first, but also want to keep it open to everyone so that we can have a bigger dialogue. So Magda, Michael, if you have thoughts, please chime in, but others can as well.
One of the things I mentioned, actually, Michelle, was not that there were more volunteers in the Hope area, but there are a lot of volunteers, according to Lisa, in the Bath area. So you could, the volunteer from Bath could go to Hope and then drive back to Bath, and another volunteer could drive the person back and forth. So that's one possibility if that person wanted to go by volunteer transportation. But again, that's we see that all the time. We come up with ideas and solutions that we think are really good ones, but you know the patient doesn't think it as much. And I think you do have to sort of go by what the the patient once when at all possible. The other point I would make is the Maine Coalition Fight Prostate Cancer is a pretty active group. They have a support group in the Rockland area. They could also be some type of support. They possibly could also drive the people to their appointments, although it sounds like again, they don't want that, but they might get some extra support from this organization. And so connecting, reaching out to the Maine Coalition Fight Prostate Cancer, they might be another resource for ideas on what to do.
Thank you.
And my thoughts were, I mean, it sounds like the wife wanted to come. I don't know, did she need to come, or just really curious about that too? But I don't know if you need to answer that.
Yeah, I think it was more their comfort level of being together while he made that long trip, and it seemed to be satisfying their anxiety to be together.
Yeah, that makes sense. And I know, people complain about logistic error and different issues that go on with that, but sometimes I'm just like, this is our only option, and if you can't wait for the mileage reimbursement, then just try. I know it can be stressful no matter what, but I encourage patients sometimes to try it and to have me involved as much as possible to at least help navigate it. Because if they're not going to be able to get anywhere, it's going to sometimes be their only option. So it sounds like they were able to get enough help to get them there and back, but I do kind of just encourage patients that I can help explain the system to them and support them, even if they've had negative experiences in the past. This is something that we can make more positive experience. Hopefully, not that it's going to be a wonderful, like they're going to rave about logistic care from the whole time, but at least it might make it a little less aggravating and more successful. I mean, all the logistic care providers or transportation providers that I book the rides with know me on a first name basis, and if they know I'm calling in and angry, they have a complaint form already up on their screen because they know that I have a complaint to file and all of that. So I kind of just keep supporting patients on using the resources that they have instead of creating even more stress trying to piece other things. That's my thought.
Thank you.
Thank you both for answering the questions. First, do folks on the phone have thoughts for Michelle's case, or we can take general questions as well?
I have a resource I'd like to share. This is Devin.
Please.
Can you hear me?
Yes, we can hear you.
Okay, good, because I can't hear myself. Okay, there we go. So needymeds.org is a great resource to find funding for different diagnoses. Yes, it's a great resource to find co-pays and free medication assistance. But if you go under needymeds.org, and then you go under patient savings, which is a tab at the top, then go under diagnosis specific and search by diagnosis. So in his case, it would be prostate cancer. So looking under prostate cancer, let's see, there were a couple listed. And you have to look under, all the way to the right, it says areas of service. You want to make sure it either says Maine or national. And there were a few that were listed for prostate cancer to help with transportation. So that's a great resource to check out for any diagnosis if you're looking for copay assistance or help with travel, lodging, anything. Okay?
Thank you.
Yeah.
Yes, thank you very much. And I think we did have a question come in earlier about the chat, or through the chat, regarding the VA, and if anyone knows whether they reimburse for all VA patients or if it's only disabled VA patients.
That's something you should double check with her, but it was also people who, individual veterans who had income less than $13,000, And also veterans who were receiving a VA pension were eligible, according to my understanding.
Great, thank you, Michael. And are there other questions from folks, thoughts, or maybe you have a case that you would like to troubleshoot in our remaining minutes?
Hi, this is Mary White, and I just wanted to say to Magda, I'm sorry. I just wanted to join in with your empowerment for main care folks to know that system and to encourage them to send their sheets in as soon as they can so that they get in a regular routine of getting a check rather than saving them up for 6 months and then trying to get money that way. We encourage people to do it, proactively rather than waiting. And I think once we've explained that to them, we've noticed a change in the climate in our patients that get main care. They like it when they get a regular check. So I just wanted to validate that for you, because that does help when we explain those programs to those individuals,
And Mary, to tag onto that too, I have been able to call Logisticare and fight for mileage reimbursement when they don't pick a patient up and the patient has to drive themselves. Yeah. So it's another then I'm like, no, you need to change that over to mileage reimbursement so that they don't miss that opportunity too. And just another way to get patients to feel like they aren't getting screwed over by a system that's not always perfect.
I just wanted to share a little tiny story with the rest of you. I had a patient at 6 o'clock at night, left here by Logisticare, and I said, oh, they can't do that. And we did get her home, and I did get the money back. I got her reimbursement, but that was a case where she had treatment, had to get back to Ellsworth, which is 45 minutes away from us, which is relatively short in our area because most of our patients are so far away. But that does happen, and it's good that we're all fighting for getting them reimbursed, because they don't deserve to be left behind. So thank you.
Yeah, thank you for sharing that, Mary, and for your questions and reinforcing the idea of empowering patients. And that will actually be, I forget which month, but we will be talking about patient empowerment at one of our upcoming sessions for this Project Echo. Other thoughts, questions from people? We have about 3 more minutes left of our call this afternoon. Okay, I had a meeting earlier this week and I tried to sit still for an entire minute and not say anything to give people time to answer, and I only made it not that far. But it does look like Carrie has a question, and it's okay if it's not related to transportation. But what's the resource you're looking for? Does anyone know of a gynecology navigator?
So it's Magda. I can say that Maine Med right now does not have the gynoc navigator in place, but if it's related to that office, she can just hire one. You added more to that question. So you just hired one and she needs to train with another. I know 2 that worked as navigators here at Maine Med. Neither one are working in that role right now, but I can find out if they can be connected. That might,
I think.
Yeah, I can email you, Carrie.
Great, thanks, Magda. Anything else for today? Okay, well, I want to give a big thanks to Magda and Michael and Michelle for their presentations and presenting the case studies, and for all of you for calling in. We continue to have really good attendance numbers, so we're really excited about it and hope that this continues to be beneficial for everyone in your learning and your day-to-day work. I will follow up likely tomorrow morning with a post assessment that we ask everybody to complete. And I'll also have a recording of this session as well as the slides, and those are always posted up on our website as well if you want to look back on any prior sessions. We will meet again on September 25th at the same time at 3 o'clock until 4 o'clock. And that topic for September will be prevention and detection for cancer. So if you have a case study related to prevention or detection, please send it my way and I will email lots of reminders to submit case studies as well. So again, thank you everybody. Have a wonderful afternoon and enjoy the Labor Day weekend.
Thank you.
Bye.